Ever get that feeling like you're scrolling online, maybe reading about health, and suddenly you need like a medical dictionary just to understand what you're reading?
Oh, tell me about it. Especially with all the cardiology terms, it's easy to get lost.
Right. Totally. So that's what this deep dive is all about. Cardiology, but like decoded. No jargon allowed. Basically, your crash course in understanding what your heart is trying to tell you.
I like that.
So we found this article, Common Medical Terms for Cardiology, and well, we're going to break it down so that next time you're on WebMD or, actually talking to your doctor, you feel totally confident.
It's all about empowering yourself with the right information.
100%. Okay, so first up, we got to talk about the heart's like plumbing system.
Okay, yeah.
All those pipes and pathways that literally keep things flowing.
Perfect analogy. And just like pipes, those arteries, well, they can get clogged. And that is what we call atherosclerosis.
Atherosclerosis. Okay, so not to be like overly simplistic, but basically we're talking about plaque buildup, right?
Right. Basically, yeah, it's like all that gunk, cholesterol, fats, whatever, building up inside your arteries and narrowing the passageway.
And that can lead to a whole bunch of other problems, right?
Exactly. That's the thing about atherosclerosis. It can be at the root of so many other heart issues.
Oh, wow. So is that where something like coronary artery disease or CAD comes in? I see that one everywhere.
Bingo. Think of your coronary arteries like the dedicated lanes on a highway, delivering blood straight to your heart muscle.
Okay, so those are important ones.
Essential. And CAD is what happens when those lanes get clogged. And that can lead to chest pain, what we call angina, because your heart's not getting the fuel it needs.
So then what about like when your leg hurts when you walk? That's a circulation thing, but not CAD, right? Because it's not the heart itself.
Exactly. You're talking about peripheral vascular disease, PVD, same clogging issue, but different set of pipes.
Yeah.
It just goes to show how everything's connected.
Wow. So it really is a whole system. And speaking of things that are connected, what about cholesterol? We always hear about good and bad cholesterol, but is it really that simple?
It's actually a pretty good way to think about it. You've got your HDL, the good cholesterol, which is like your cleanup crew, going around, picking up excess cholesterol, taking it to the liver.
Okay. I could use a little more of that cleanup crew, I think.
Don't we all? And then, of course, there's LDL, the bad cholesterol, and that's the one that contributes to those plaque buildups we were talking about.
So if you're trying to increase the good and decrease the bad, is that where diet and exercise come in?
You got it. It's not just about knowing the terms, right? It's about understanding how they connect to your everyday life.
I like that. So we've covered the plumbing, but what about those times when like you can feel your heart doing something funky?
You mean like skipping a beat or?
Yeah, exactly. Is it more of an electrical issue?
Yeah, that's where we get into the heart's electrical system. It's like the conductor, right?
Yeah.
Keeping that beat nice and steady.
I like that analogy. The conductor. So what happens when the conductor like misses a beat?
Well, you might just get a skipped beat or two, which is what we call premature contractions. Most of the time. Totally normal. Just a little blip. Maybe you had too much coffee that day or something.
So those heart flutters that people get, that's often just those premature contractions.
A lot of times, yeah, it's nothing to worry about.
Okay, good to know.
But, and this is important, sometimes those rhythm disruptions can actually be a sign of something more serious.
Oh.
Like atrial fibrillation.
AFib.
Exactly.
AFib. Another one of those terms you see everywhere.
Right. And for good reason, it's pretty common.
So what's actually happening in the heart when someone has AFib?
So instead of that nice steady beat we want, with AFib, the upper chambers of your heart, the atria, they kind of just quiver.
Quiver.
Yeah, like a hummingbird's wings, super fast, not very efficient.
Well, that doesn't sound good.
Not really, no. And it can make you feel really crummy.
So what would it feel like if it was happening in your chest?
You might feel like your heart's racing or skipping beats, or some people say it feels like it's doing a flip-flop in there.
Okay, that does not sound pleasant.
No, not really. And because the blood's not flowing as smoothly, it can lead to all sorts of other issues, fatigue, shortness of breath, even increase the risk of stroke.
Really?
Yeah, because the blood can pool and clot more easily.
Wow, that's scary.
It's definitely something you want to be aware of.
For sure. It's crazy how much we take our heart for granted until something like that happens.
It's true, we do.
So if you're like feeling weird heart rhythms, definitely talk to your doctor, right?
100%. Yep.
Better safe than sorry.
Absolutely.
Okay, so how do doctors even figure out what's going on in there? I know there's that thing, an EKG.
Yeah, electrocardiogram.
EKG, is that what they actually call it? Electrocardiogram.
Yeah, but EKG's fine. We're not here to impress anybody with big words, right?
Exactly. Okay, so what is it? What does it do?
Basically, it records your heart's electrical activity, and that gives us like a visual representation of your heartbeat.
Interesting.
Like a musical score for your heart. Shows us the rhythm, any weird stuff going on.
I like that. A musical score.
Helps to visualize it.
Definitely.
Yeah.
So we've talked about the heart's plumbing, its electrical system. What about the muscle itself?
Oh, good point. The heart is a muscle after all, right?
Exactly.
And that's what it really all comes down to, the heart as a pump. And when that pump's not working as it should, well, that's where we get into conditions like cardiomyopathy.
Cardiomyopathy, what is that? I feel like that's one of those words they use on like Grey's Anatomy to make it sound scary.
It does sound kind of intense, right?
Yes.
But really all it means is that there's an issue with the heart muscle itself. It could be weakened, enlarged, stiff. The bottom line is it's not pumping blood as effectively as it should.
Oh, okay.
Think of it like any other muscle in your body. If it's tired or overworked, it can't perform as well, right?
Yeah, totally.
Same deal with your heart.
So if you do have a weakened heart muscle, are there things you can do to strengthen it?
That's the million-dollar question. It depends.
On what?
A lot of things. What's causing the cardiomyopathy? How severe it is? There are definitely things you can do to manage it, improve your heart function, but it really depends.
So what kind of things?
Well, lifestyle changes are huge. Diet, exercise, all that good stuff. Sometimes medication can be really helpful, but it's important to remember that cardiomyopathy can be progressive.
Meaning what?
It can get worse over time.
Oh, that's not good.
And in some cases, it can lead to something called congestive heart failure, or CHF.
CHF, okay, that sounds serious.
It does.
Like that's the end.
It's not as scary as it sounds. Congestive heart failure doesn't mean your heart just stops.
Oh, good.
It just means that it's having trouble keeping up. It's not pumping blood as efficiently as it should, and that can lead to fluid buildup in the body.
So it's not like a light switch. It's more like...
We're like a dimmer.
Okay, yeah.
Yeah.
Makes sense.
It's a gradual decline in your heart's ability to do its job.
And those other things we talked about, the clogged arteries, the rhythm problems, those can contribute to heart failure too, right?
They can, yeah. It all kind of ties together, you see. It's all connected.
A whole domino effect.
That's a good way to put it.
This is really fascinating, though. Like, I'm kind of geeking out on this stuff.
You too. I love this stuff.
I mean, that's your heart, right? Kind of important.
And essential. Without it, well.
Game over.
Exactly.
Okay, so we've covered a lot here. Atherosclerosis, atrial fibrillation, cardiomyopathy, CHF.
And we're not even done yet.
I know. But I'm feeling pretty good about all these terms now.
See? Knowledge is power.
It is. So what about those times when, like, you can hear your heart doing something weird, like a weird sound?
You talking about a heart murmur?
Yeah. Like, what is that?
Heart murmurs, they're pretty interesting, actually.
Yeah. What causes them?
Really, it's just the sound of your blood flow.
But why does it sound different sometimes? I've heard like a whooshing sound before.
That's a good way to put it. Think of it like when you put your thumb over the end of a hose, it changes the way the water comes out, right? It makes a different sound.
Okay, yeah.
So in your heart, it's usually the valves. If they're not closing all the way, or maybe there's an unusual opening, you get that kind of turbulent flow.
And that's what causes the murmur sound.
Exactly.
So is that always a bad thing?
Right.
If you have a heart murmur, does that mean you have a heart problem?
Not at all. A lot of people have what we call innocent murmurs. They're really common.
Innocent, so they're not harmful.
Right. They could be caused by anything. Maybe you have a fever, something temporary, nothing to worry about.
Okay, so how would you even know? Like if you were a patient, how would you know if you should be worried about a murmur or not?
Well, that's what you come see a doctor for. We'll listen carefully, look at your overall health, maybe run some tests, you know, the drill.
Right, right.
Sometimes it can be a clue to a different heart issue, but sometimes it's as harmless as like a freckle or something.
Oh, wow. Okay. Interesting. What about when you can actually feel your own heartbeat? Like if it's racing or skipping.
Palpitations?
Is that what that is? Palpitations.
That's the word for it, yep.
And is that always a bad thing?
Not usually, no. I mean, we all get them from time to time, right? Stress, exercise, too much coffee.
Oh, yeah, for sure.
Even just being dehydrated can do it.
Okay.
Yeah.
So pretty normal stuff. So when would it be a sign that something's off?
If it's happening all the time, or if it's really messing with your life,
Okay.
especially if you're having other things going on at the same time, like busyness, chest pain, things like that.
So it's like your body trying to tell you something's wrong.
Exactly.
Gotcha. Last term on the list, and it's a little bit of a scary one, syncope.
It's not as bad as it sounds.
What is it?
It just means fainting.
Oh.
Syncope is just the medical term for it.
So what's going on with your heart when you faint? Why does that happen?
Well, it's not always related to your heart, but it can be. Basically, your brain is not getting enough blood flow for a minute.
So like if you stand up too fast and get a head rush.
Exactly. That's a classic example.
Yeah.
But it can sometimes mean there's a heart rhythm problem, so that's why it's good to get it checked out if it's happening a lot.
Makes sense. So much good info here. I feel like we could talk about this stuff all day.
Me too. There's so much to learn.
But for now, this is a great start. We've decoded so many cardiology terms. What a crash course.
Right. And the best part is you can use this knowledge to advocate for yourself, ask your doctor the right questions.
Exactly. Knowledge is power, especially when it comes to our health.
I love that.
Right. It's so true. Well, that wraps up our deep dive on cardiology terms. Hopefully, everyone learned something new today.
Me too.
And remember, if you're ever unsure about something, talk to your doctor. They're there to help. Thanks for joining us on this deep dive. We'll catch you next time.